Hi, this is Dr. Yoon Hang Kim, and today's recording is a bit different. This is what I consider sponsored education series, and this is functional medicine round. In medicine, giving a lecture and educating other physicians is considered round, and and there's grand round, which is super formal, and this is just doing rounds or learning in an informal manner. And so this person is a female in mid 70s with long-term chronic fatigue syndrome, also known as myalgic encephalitis, following Epstein-Barr virus in the 90s. And unfortunately, this person is housebound most for last 6 years, but much better since taking low dose naltrexone. So first of all, I'm very happy that this person is taking naltrexone. I'm also very happy that the naltrexone or the low dose naltrexone helping is already telling me some clues about this person's situation. So the main symptoms is low energy, post-exertional malaise. That means if this person goes out in a walk or shopping or does any activity, physical activity, this means that the person may just crash and not have a lot of energy left. Cognitive symptoms are extremely sensitive to chemicals, and the person can get palpitations, blurry eye, dizziness, vertigo. And the person is wondering, can this be mast cell activation syndrome or MCAS? And the person's comment is that LDN is helping with neuropathic pain, light sensitivity, energy to some degree. And this person is not eating gluten, dairy, and not eating meat, and eating low carb. Taking methylene blue, comments that rapamycin is not available in the country this person is residing in. And she mentioned another medication that her doctor is considering. And I'm just happy to hear that, because I think that there is a generally a erosion of trust between physician and patient. And long time ago, people commented they don't trust HMO, but they trust their doctor. But that was about 40 years ago. And now I think general sentiment is that I don't think there's a lot of trust. And maybe there's a good reason for that. And there's a reason why I don't practice medicine anymore in the health insurance system, because it doesn't create more trust. Like the last system that I helped to create, wonderful, trustworthy program. As soon as I left, they decided to have the time less, and time is critical for healing. You have to create space and time for healing. So as a functional medicine physician, one of the things that I hear from the history actually in functional medicine, in my opinion, is the most important part. The physical exam may be important, and I zone in on doing physical if the history warrants it. But most of the times, about 90% you can get from the history. The fact that the history says that chronic fatigue after Epstein-Barr infection, that to me says that this person's infection may not be optimal. And I sometimes will use a very strong word such as deranged immune system that is no longer functioning its job. It will attack itself rather than attack what needs to be attacked. In this case, I think if this person had been my patient, I would get a panel of showing chronic hidden infections. And in the US right now, that would include viral infections as well as at least the baseline Lyme testing. And it gets really expensive really quickly. So not necessarily I would test the best test for Lyme, but at least a test that is screening, yes, screening, no, at least start there. And then the viruses, there are a whole bunch of viruses that can be included. Definitely Epstein-Barr, CMV, cytomegalovirus, as well as HHV. And there are many types of herpetiform or herpes related um, viruses, and not all of them are sexually transmitted, and even the sexually transmitted cases can be transmitted just through fluid exchange. So I think that for this person, that's to me is check the viral load and what viruses may be active. That would be the first thing. The second thing that I see is the reaction, and I think it could be MCAS, which is also connected to the autoimmune system, like postural orthopedic tachycardia syndrome or POTS. And how do I look at this is that I've noticed that MCAS is basically a mediator or middle person in the middle of, let's say, chronic viral infection. The immune system gets confused or deranged, and MCAS can develop. I've seen it happen in mold infections. I've seen it in Lyme infections. And once the immune system is deranged and the targeting is now not outside but inside, I think anything's possible. And if it targets the autoimmune or autonomic nervous system, then the palpitation, dizziness, and vertigo would make sense. Even blurry-eyed would all make sense. The fact that LDN is helping is really wonderful for this person, but more than that, it's wonderful because it sheds light to the ideas, what could be. So let me expand on that. Low dose naltrexone does several things, but one of the things it does is that it lowers inflammation in the nervous system and in the brain. And the fact that they're calling this chronic fatigue syndrome now is myalgic encephalitis says that brain is inflamed by definition. And the fact that LDN is helping and neuropathy is helping, this is very, very consistent. A lot of people use low dose naltrexone for the purposes of using the autoimmune, and that's the most popular use. But in reality, what I find is that that's not the best or highest use. The highest use for me is neural inflammation, nerve inflammation is better, brain inflammation is better. So the fact that the person has hit a plateau, the person's taking methylene blue, but I don't know the dose. So the dose, Paracelsus, a Roman scientist, said, and physician said that dose makes poison. What that means is that in methylene blue, that's literally true. Super high methylene blue is poison to the body. But the doses that I like to use, like 0.5 milligram to probably about 4-5 milligrams, depending on sensitivity of the people, is going to be a dose that is more protective from oxidation. The higher doses, I think, especially the doses that was used to tackle antimicrobials, that is going to be more oxidizing. So for me, that the fact that methylene blue is in play is interesting. I think it's helpful. I'm unsure about how good methylene blue is for virus, but the fact that they did use it prophylactically during World War II on the U.S. troops, it may have a broad action than some of the other things like quinine or quinine. So let me, and this is a little tricky because food is really, really, really sensitive issue. I realize that. And in my understanding, food is as sensitive as sex. So I don't say this lightly, but some of the people that I take care of who are the sickest are vegan people. And I'll just leave it at that. I know that I said this now, people can hate me, but I think that we need protein, we need fat. One thing we don't need is carbohydrates. Our body, through gluconeogenesis, has a way for us to produce excess or needed carbohydrates. Otherwise, those of us who do ketosis would pass out when the blood sugar is low. But thankfully, sugar is really important. It's so important. It's so essential. It's so vital that we make our own. And in order for us to do that, and this person is taking low carb on a vegetarian, that really means that this person is going to have a probably functional protein deficiency and other nutritional deficiencies, also a suspect. And there's a test called micronutrient testing, or some people do it through organic acid testing. It's just different style. Organic acid is more shotgun, but it's not a direct testing. It tests the metabolites in the urine. My personality, I like direct, so I do the direct testing. And no testing is perfect. All testing is capable of lying, false alarm, or missed the boat. And that means that it's not there, but it's that it cries wolf. It's there. Or in the story, if you cry wolf too much, when the wolf really comes, nobody pays attention. That's the missing the boat. So just to summarize in this person, I would say that discussing with her physician about possibly checking the titers of the chronic infection likely causing viruses would be something we can do in an ideal situation. In a non-ideal situation, I think that the minimum they can do is at least do a trial of medication to suppress the Epstein-Barr virus. And this is not standard of care. This is not proven, but I have seen this kind of approach be helpful. In regards to methylene blue, the higher doses of antimicrobial action is worthy noticing. And in some ways that pro-oxidation is interesting, but has to be careful because we want to be very careful about causing pro-oxidation in people. And so that needs to be done under medical guidance. And then rapamycin is a very interesting molecule, and that's something that I can cover. But if this person is interested, my understanding is that there are sources in India that will ship directly, at least to the US. And as to other medication, I don't know. I leave that between this person and that doctor. This is Dr. Yoon Hang Kim. I'm an integrative medicine and functional medicine physician with an authority in low dose naltrexone clinical use. And today was first of the sponsored educational series, Functional Medicine Rounds. Thank you.